Here we go. Straight ahead. Awesome, brother. Tuck down like that for me. Man. Awesome. Turn right, turn left. Hold your head up nice and straight. That's perfect. Excellent. Your other side, please, sir. You got it. And turn towards the back wall and look all the way up. And big smile for me there. Awesome. All right, man. Make yourself comfortable right here. All right, so here we are with Cameron. Cameron is here for another procedure. We did Cameron's surgery 3 years ago, huh?
3 years ago. I was balding.
3 years ago. Holy smokes,
Yep.
man. It flies, doesn't it?
It flies.
You got better looking, man.
Oh, yeah. I have all my hair now.
How has it changed your life? Is it,
It made me extremely confident. I'm not worried about anything anymore. I think it brought a lot more ladies in my life. Definitely just got me out there wanting to conquer the world.
Awesome.
Just with having a little more hair. I'm actually a manager at Whole Foods now, and
No
I'm
way.
taking over. Yeah.
That's awesome.
Yeah. So now I just kind
Congratulations.
of want to just tweak in the sides and just kind of keep killing it, you know. So.
All right, cool. So how was the procedure after you did it? Did you have pain? Was there issues as far as healing went?
No, actually I had no pain at all really. For the most part, everything was kind of smooth and easy. It was just kind of one procedure, and after that, it was just kind of just living my life after that.
Okay. Now, are you taking any preventative treatments? Are you doing Propecia? Are you doing minoxidil?
I am doing Propecia. You guys told me to do Propecia. It was kind of something to help, like the hair a little more healthy, which I did that. I've been doing it every single day now, and obviously it's been helping. I actually grew a beard out from it too, so.
Awesome, man.
Yeah, it
Right.
did more than I wanted, so it was good. It was
That's
good.
awesome.
It's good.
All right, just so everyone's on the same page, I always recommend 2 procedures for my patients. What we're trying to do each and every time we do a procedure is first off, keep what's there naturally. That's what we do with the preventative treatments, which are finasteride, which is better known as Propecia, minoxidil, which is known as Rogaine, and lastly is the laser comb. These are 3 FDA approved treatments that work to help you keep what you have in place. They're all sold inexpensively right now. Everything's generic. There's really not much of a cost to do everything you can from your end from an FDA approved preventative regimen to keep what's there. So the first procedure is what we call the base. What we do is we create that nice, soft, natural looking hairline, which helps to reframe the face. We create it with soft little 1-hair grafts all the way around. Then behind the frontal hairline, we use something called a multiple follicular unit graft to help create the density. What I try to do each and every time I do a procedure for a patient is get them the most density I can get them in a single session. What happens is when I put my grafts too close next to one another, they will compete with each other for the same blood supply. My overall yield will go down, meaning the amount of hairs I get if I put them too close, because they're competing for the blood supply and not surviving. So that first procedure is what I call the base, which is where we're setting everything up. We blend into the existing hairs on the sides, which is the transition from the grafted hair to the natural hair, so something doesn't open up as they age or they lose the hair over time. Then once we have the grafts that from the previous procedure with the established blood supply, then we're able to go in between those grafts to help create more density and to finish the patient up. So although the majority of my patients are happy with a single procedure, we always recommend a second procedure to finalize things. So with Cameron today, we are going to continue to finish up what we started. Then what we're going to do in addition to that is we're going to bring his temples out to help reframe the face. So, sound like a plan?
Sounds good.
Okay.
I'm ready.
Extremely important. Got to stay on the treatments, okay? You got to stay on the treatments to keep what's there. One more procedure, we should get you out of here because we'll be able to finish this up. I usually can knock the temples out in one pass.
Cool.
And you're in business.
Cool.
What I'd like to do is show the camera the suture line. I haven't even seen your suture line. Let's check it out and see how we did. So this camera's going to see the suture line at the same time as I am. Alright. So let me just get it back here. Alright. So when we do a MaxHarvest hair transplant procedure, what we do is we harvest all the way from the one side over here. We take it around all the way to the other side over there. Can you get your puppy feet up there for me, please? Excellent. Okay, so suture line. Okay, so that's the suture line right there. So you can see this little tiny trace line right there. You see that? So there's our suture line. Okay, that's spinning around. The camera's seeing this at the same time as I am. That's the suture line right there. You can kind of see that the whole way. As you can see, it's completely undetectable. So right now we're looking at a suture line. Now my famous cameraman here, Josh, is right here. He always likes for me to use an example of showing how the suture line compares to just a natural fold in the hair. So here's that suture line. Okay, now we're going to go right above it. Okay, we're just going to create the same thing as a natural crease in the hair, like that. And what Josh always likes to point out is there's no difference between a natural crease in the hair to the suture line that we do on our own. So it looks the same. So let's just finish that up all the way around. So there's that suture line all the way through there. And we'll take it all the way to the edge, and then that's the suture line all the way there. Okay. So he healed absolutely beautifully. Let's take a look up at the hairline just to see the work. So what we did is we created a nice soft natural looking hairline all the way around, all created by the tiny little 1 hair grafts. Little 2-3 hair grafts are behind that to create a little more density, and the multiple flick unit grafts are behind there. So as you can see, 100% undetectable, nice and natural the entire way around. Filled in nicely, beautifully natural, can't detect anything. Now we're going to go through and we're going to thicken it all and finish it all off. And that's the plan for today. Do you have any questions about anything?
No questions. I'm ready.
All right, here we go. Let's do it.
Sounds good. Thank you.
Awesome.